Today we're talking with Dr. Laura Perry. She specializes in geriatric medicine. She also holds the role of Oregon Chair of Geriatric Medical Education. Now, Dr. Perry, you're going to be working with medical residents to teach them how to care for older adults. Why is that important?
People are different and aging affects us differently. When I was training, I had 2 patients in a row who came in for the same reason. They both had been blown over by the wind and broken their hip. But one of them had been on a multi-day sailing trip when a sudden storm hit and he was blown across the boat. The other person had been walking into a restaurant with her walker when a sudden gust blew her over. Those are 2 very different people with 2 very different bodies. They're going to react very differently to the surgery to repair their hip, but healthcare often treats them as if they're the same. My job is to make sure that the doctors graduating from Providence residencies know the difference between the 2.
So tell me, what will you be teaching medical residents?
The American Geriatric Society organizes our education into the 5 M's. Mind, so what happens to our brain as we get older? Why does dementia happen and what do you do about it? Mobility, how do people get around? Why do people fall? Why does walking become difficult? Medications, how do our bodies respond differently to medicines as we get older? How do those medications interact with each other? 4 is multi-complexity. People as they get older don't just have one condition, they often have multiple. How do those add on top of each other, and how do you look at the person as a whole as opposed to just a collection of diseases? And 5, what matters most? How do you get to know the patient as a person, particularly as people get towards the end of their lives, and sometimes you have to have very difficult conversations about that.
You're interested in seeing the residents do rotations in nursing homes. Why is that important?
People go into nursing homes oftentimes after a hospital stay, but many doctors working in hospitals have never been to a nursing home, never spent any time there, and sometimes they have unrealistic expectations of what can and can't happen there. I want to make sure that the doctors who are working in the hospitals know what their patients can expect when they get to a nursing home to make those transitions of care safer and more patient-centered.
Now, you're developing and standardizing geriatric curriculum for 2 of Providence's medical centers and 2 of their hospitals. What kind of impact do you hope this will have?
I hope that by the time the residents graduate from the program, I don't necessarily expect all of them to become geriatricians like me, but I hope that all of them will be able to care for their patients as if they were geriatricians in a way that is capable, competent, compassionate, and caring.
Dr. Perry's work is made possible through a generous donation from the Springs Living Retirement Company in McMinnville. Dr. Perry, thank you so much for your time today.
Health Watch, sponsored by Providence Health and Services.